Before anything else, I want to thank you for listening. Thank you for giving a chance to rebuild the broken healthcare debacle of this once great nation. The way my plan works is simple. It looks for different expenses within the healthcare realm that are either wasted or not necessary, and defines ways to get rid of these without limiting medical care, health care, or causing any detriment to the healthcare system. And in fact, just the opposite, helping the healthcare system, and also by reducing all of these extra unnecessary expenses saves significant funds out of the pocket of both the people, the patient, as well as insurances and from healthcare as a whole. So I have several lecture topics, and I use that terminology loosely because these are not lectures. These are interactive. I want people's opinion, and this is a suggestion. I have further listed methodologies systematically written on each topic that I am going to talk about in this session. But I have not included all the significant detail of my further topics systematically broken down here. Instead, I tried to briefly summarize and briefly talk about each of somewhere between a dozen and 15 major topics, major categories that if we truly understand them better, then we will be able to correct them. So first I give a basis and an understanding of what the situation is from combination of personal experience and general information. And then I follow through to identifying methods that can correct this exact situation specifically. And while many people are naysayers, while many people complain and write blogs over the internet that will name certain policies that are no good, that does not help. So I have identified situations and regulations and circumstances that are broken, wasting money, and ruining the population and ruining healthcare. And then I have demonstrated specific examples of how to correct it. In other words, I complain about the problem and I itemize and demonstrate how to fix it. So these are not blind complaints. But the big difference from what I did compared to many things I have seen is my solutions are very, very simple. In fact, I am going to suggest that many of them are so simple that that's why they have never been done, because they use logic, and our current system defies logic. My system uses logic, simplifies solutions, and gives no reason why these solutions should not take place immediately. We do not have to revamp the entire healthcare system. We do not have to change the entire complexity of this situation as a whole. We just need to modify and add certain regulations. There's always a lot of talk about Obamacare. Obamacare was destined for failure from day one, and I have cited examples and specifics as to why. But whether Obamacare is repealed or corrected or modified is inconsequential to my solution. You see, my solution goes at the heart of the problem to bring down unnecessary expenses in a timely and systematic fashion, and looking at the medical arena as a business, which it should be looked at in this modality. If there's money involved, it's a business. Run it like a business. Don't run it like a broken situation that has no ability to fix. I think overall, anytime I have seen or heard of proposals to help correct, manage the healthcare system and the healthcare issues, they always go about this in the wrong fashion. So we are going to go about this in the right fashion. And I am going to list and explain to you exactly the specifics for correction. And I will apologize that because I am involved with healthcare and I am not a computer or internet guru, this next recording will be broken up into 2 parts. So please listen to both parts so you will get the whole effect. I've gone through topics specifically involving the following major headings and all the details within them. First, I've identified what the problem is, and then, unlike many proposed solutions that simply complain about the problem, I offered the exact, precise, itemized, detailed solution, and in such a simple fashion that it boggles my mind how these solutions cannot be incorporated into the system practically immediately and automatically correct these major issues. I start with identifying exactly why Obamacare and the Affordable Health Care Act failed and would fail if it wasn't ceased. It is a fraud. It is a facade of healthcare. It is not a savings of healthcare. It is nothing. It wasn't even a temporary Band-Aid. It was an effort to put things on hold and make them worse temporarily while the major issues could be figured out. I will explain why and demonstrate how it actually ruined the healthcare system further and what we need to do because of it. Then I will explain about the cost of medication at the retail pharmacies and why medication costs are so expensive and solutions for how to decrease these medication costs without affecting the major pharmaceutical companies. Interesting. Underline without. So Big Pharma, the major pharmaceutical companies, will not be against my plan for decreasing the overall medication costs at the retail pharmacy, and they may even be for this plan if they want to show more profit for them, because that's exactly what this plan does, while it brings down the cost for the everyday consumer and the patient and the general public. Seems impossible? It is not. It is definitely possible and quite simple to do. Next, we address the financial difference between medical physicians that were trained in other countries and medical physicians that were trained in the United States. And I break down the difference as to why there is a cost-based separation that basically brings less income to American doctors and gives more expenses to American doctors that many of the foreign doctors do not have. This is in part the reason why there are more and more foreign doctors and less American-born doctors. Part of what is intertwined in the American medical system is paying for some of these expenses that the American-born doctors have that the foreign-born doctors do not have. And I identify and specifically and systematically break down what these are and what we can possibly do about them. The next topic I talk about is something called testing-based liability. It basically sums up to say that doctors have a pretty good idea after examining a patient and listening to a patient of what needs to be done. But in this world of liability, we have to jump and run to multiple CAT scans, multiple MRIs at our fingertips and using other diagnostic tools and laboratory data. And there are definitely many, many times these type of diagnostic tools are necessary, but there are also many, many times where these type of diagnostic tools are used as liability factors. And I identify and specifically and systematically map out how to create a protocol as to when these need to be utilized and when these are utilized for nonsense liability reasons, and to protect that liability while not having to perform extra diagnostic expensive testing, especially when the physician really feels as it is not necessary. We need to change the protocol, and I identify exactly how. And if we change that protocol, then we lower expenses of medical care while at the same time still providing excellent care. The next topic we talk about is coding and diagnostic and procedural terminology, coding and billing. And this is a topic that cannot be summarized, so one has to listen to the recordings. But I will say that I demonstrate a plan to simplify all of the diagnostic and procedural coding. That's right, to simplify it. And in business, when you simplify something, you bring down expense. In my systematically developed plan, I can bring down the expense of coding and billing by making it simple, and therefore bringing down the expense of a regular medical visit to provider, clinic, hospital, wherever it is, by cutting their overhead and thereby decreasing the overall cost. But I also identify exactly what is the reason why these coding systems are so complicated, and we address this, and we show how and why to remove it, because they are only going to head the system into a downward spiral away from proper health care. My system recovers it with less cost expenditure, and in a much more simple fashion than we exist already. Next, I addressed something involved with that type of medical coding and billing. It is called global periods. After surgical or procedural codes, there are global periods. This is a foreign topic to people who are not involved in the medical field. However, it is a way that insurance companies try to save money, but in turn, it actually loses money for the insurance companies. And I exactly demonstrate why it loses the money by costing more, and how we can simplify this and make it cost significantly less and save money for both the insurance company as well as the regular consumer, the patient, and by far increasing the value of the health care provided. In other words, providing better health care, better continuity of care, and decreasing cost all around. And it's such a simple process. In fact, that is one of the most simple of any of my solutions, and it is a simple, basic, one-sentence legislature that could be added into all of healthcare regulation, started tomorrow, and the savings and the benefit would immediately begin. I also talk about how to decrease cost expenditure to both patients and insurance plans in the next topic, which deals with something called facility fees. Those are the associated fees to medical visits and medical treatments by the facility, by the hospital, by the clinic, wherever it may be. There are fees built in that can easily be decreased to save the financial ruin of the healthcare system, while allowing the private practitioner to still provide excellent care, and in some contexts, not only the same care, but better care with increased income, while still saving the insurance and the financial responsible party, the patient, the expense. all simple regulations that could be infused into the system within a day. Another factor for cost savings and medical benefit. The next topic we talk about is something called tort reform. That's right. Overhauling the liability side of medicine. But in my system, I am not proposing to get rid of medical malpractice, and I am not proposing to do away with liability. But in my system, I come up with methods to specifically make protocol and identifications for what needs to be done and what does not need to be continued relative to the medical liability arena. And by identifying these, and by beginning these protocols, we decreased cost expenditure in the medical liability arena. In the medical malpractice insurance game, we decreased payouts in that field, thereby increasing income to the liability insurance carriers and decreasing premiums to the medical practices, providers, clinics, and hospitals, while at the same time, those decreases in the premiums transfer on to everyday patients by decreasing the overhead, so the patients and the insurance carriers pay less, while at the same time keeping liability regulation but making it more regulated in terms of protocol instead of this current haphazard way of a broken system where unfortunately now we have lawsuits because a child is born and on the left eye they have 27 eyelashes and on the right eye there's only 26 eyelashes, and there's a major lawsuit. We talked about what constitutes a valid malpractice issue, and we talked about what constitutes an invalidated malpractice issue, and law and regulation created to utilize in a protocol form of regulation to decrease time and wasted expenditure on certain liability issues that are simply not that, while at the same time putting more effort into liability issues that truly are valid. And my way identifies the difference, how to assess them, a protocol whereby to follow to continue to validate certain situations and continue with these situations and keeping the system working while regulating it a little more. So overall, my system of that brings down the cost expenditure to the medical facility, doctor, clinic, practice, which then transfers to the patient or the insurance plan that there is less cost passed on. Then there's less premiums to the physician or the medical practice, and the insurance carriers are paid more because they save more money from dishing out larger payouts if they don't have to, according to my system, because money is infused back into them, and I have not identified here how that works, but you will see in the protocol in an amazing way. And the malpractice attorneys still have their arena. It is just regulated slightly more as to what constitutes what. It's an overall savings of both protocol, liability, and money around and across the board, and savings of healthcare without diminishing any type of healthcare provided. The next topic we go to is in a different arena. It talks about the difference between certain participants that are unfortunately disabled and utilizing benefits of Social Security disability and other social services, such as welfare, Medicaid, food stamps, etc., and identifies a protocol to specifically regulate the overuse by undeserving people of these type of federal and state assistance systems. There is such an abundant overuse of it. If we cut down the fraud overuse of those systems and we do nothing else from any of my plans, it would suffice. It would be sufficient to save significant funding from government assistance. But it is just one element of my multiple detailed plan to save overall this arena. So I identify how to make a protocol to cut down on the fraudulent usage of these systems while at the same time still providing good benefit of these systems to those who need it. And a protocol whereby how that gets reported, how it gets utilized, and where the information goes, and where the funds go once the fraud is diminished. Basically, according to my plan, the people who need it benefit more. The people who don't need it are going to pay the price. And we identify a protocol how to specifically find out and identify who those are. And any doctor, provider, clinic, hospital listening to this knows of the overuse of those systems by people who don't need them. There have been many complaints over the years of fraudulent usage of these systems. I do not complain in my lectures about this. I create the protocol of how to correct the problem. We follow that, we fix the system. And regarding the Medicaid portion of that system, not only do I show how to stop the overuse and abuse by those who don't need it, but I show how to save money from the system by actually being able to overhaul and stop elements of the Medicaid funding program and instead have a trade-off where physicians, hospital clinics have a certain level and certain quantity of service that they need to provide, and instead of billing Medicaid for their service, there are credits as to certain government fees that the physicians, hospital clinics need to pay. And thereby, the credit is on paper only. The federal government, Medicaid, does not have to dish out funding and payment, and there is more funds saved and retained within the government system. And that is only one of many, many ways I address how to fix this problem. Some are a little complex, but some can be initiated within the blink of an eye in one day. So simple. What's also simple is that, unfortunately, federal aid programs, food stamps, Social Security, Medicaid welfare, gives the same, if not more, benefits to illegal aliens who have just entered this country one day previously, whereas the World War II or Korean War veteran is rotting in a hospital somewhere because their benefits are significantly less than a person who just walked in this country yesterday. Now, this is a major topic that sometimes gets horrible publicity. However, I address it in a proper, appropriate fashion and explain what exactly could be done to level this across the board instead of having such the disparity between coverage. There is no bigotry or racism or stereotyped limitation in my system against any foreigners. There is specifically, however, a plan and protocol as to what type of system will exist to provide care and benefits for people of this country who have been here their whole lives and are citizens versus people who just came in here and showed up yesterday. Look, there's a reason why from all over the world people come to this once great nation. And benefits is one of those major reasons. And in my plan, we do not diminish or decrease those benefits. We itemize and plan out exactly what to do with them in an appropriate protocol so they are not used incorrectly. And an overall savings of money that benefits the government and benefits those current United States population who may be losing benefits to people coming in the country a moment ago. And I show ways to correct this. The rest of this recording will be continued on the next lecture, just in interest of time and volume space for this video. Please continue it. Thank you.